Hello everybody and happy Wednesday. This is Dr. Neil Schultz and this is viewer question week at both BeautyRx and at Derm TV. It's the third week of the month. Welcome to the August edition of BeautyRx Live. We're on live streaming video. I'm going to answer your questions about BeautyRx skincare products and related skincare issues. BeautyRx skincare products are the same patient-proven and award-winning products that have been giving my patients more healthy, better-looking, and more beautiful skin for over a decade. They do it by addressing and stressing the ageless issues of color and texture, in addition, of course, to lines and wrinkles. Now, since BeautyRx products are now available to people outside of my office who aren't my patients for the first time, the purpose of BeautyRx Live is to be able to answer your questions about these products to give you access to me. If you have a question that you'd like me to answer, please go to beautyrxlive.com, use the chat box, and tell me your question, and I'll be happy to answer it best that I can. So let's go to the first question for today, and that is from Sophia. And Sophia says, what effects does stress have on skin and hair? Well, Sophia, it's much easier to answer the question about the effects on skin because the effects of stress on skin are actually much more immediate. Anytime you're stressed, your body has a way of dealing with that stress, combating it, and fighting it successfully. And that involves your adrenal gland secreting a hormone called cortisol, or cortisol. And cortisol, which is called the stress hormone, fights stress and just boosts your immunity and your metabolism so that you can deal with the stress. Great. But the problem is, every time your adrenal gland secretes a little cortisol, a little male hormone leaks out with it. That male hormone is called testosterone. Now, in men who have a lot of male hormone, the little additional testosterone doesn't make a difference. But in women who have very low levels of male hormone, that additional amount of testosterone actually can make a difference in imbalancing the ratio of female sex hormones to male sex hormones. And in addition, the derivative of testosterone, dihydrotestosterone, is the actual chemical that causes acne. It actually is also the chemical that causes hair loss. So you've boosted the amount of circulating hormones that causes additional secretion of oil by your oil glands. And when you make more oil, you're going to have more acne. And this is why stress causes acne. And this effect can be seen in a day, 2 days, 3 days. But when you're talking about the amount of time it takes for hair to respond, well, the thing that causes hair loss is that same hormone, dihydrotestosterone, acting at the level of the hair follicle. But its effect is delayed by many months. So if you have a lot of stress hormone being secreted, it could take months before the stress starts to cause hair loss. But you'll see acne breakouts as the main effect of stress on your skin, certainly within a few days, and after months of continued stress, you're going to see some stress-related hair loss. We have a question from Tina. Can too much salt in your diet cause acne? Tina, that's a great question because in the United States, most supplementary salt is iodized. And iodine is the one element or food substance which is known in a dose-related way to cause acne. There's a lot of controversy about whether or not dairy products and sugar can cause acne, but there's no question that enough iodine will cause acne. So the question is, will iodized salt cause acne? And the reality is, I'm happy to tell you, there's so little iodine in the iodized salt that you'd have to consume so much salt to consume enough iodine through that route as opposed to iodine in other foods. You'd have to consume so much salt that way that it would be an overload of salt. It wouldn't be palatable. It's not going to happen that you're going to get a dietary excess of iodine through ingesting salt. So bottom line, dietary salt is not going to cause acne breakouts. We have a question from Josh, and it's about antioxidants. Hi, Josh. And by the way, again, you're watching BeautyRx Live. It's the third Wednesday of the month. If you have a question for me, I'm Dr. Neil Schultz. Please go to BeautyRxLive.com, use the chat box, and submit your question. So Josh is asking us about antioxidants. I still can't find the right antioxidant for my acne-prone skin. Do you recommend using fresh green tea every night and or witch hazel? Are these powerful enough to absorb free radicals? And are chemical-based sunscreens, can they damage your skin if I don't use antioxidants at night? Let's start at the end. Certainly chemical-based sunscreens are not going to damage your skin, whether you're using antioxidants or not. And in terms of fresh green tea is a wonderful source of antioxidants. It depends on whether you're using it topically as a green tea extract or orally. I don't think you're going to absorb enough antioxidant from taking the green tea orally because of the amount of tea you'd have to consume. You'd have to be hooked up to a catheter all day. There'd be so much water flowing through your system, coming in and coming out. So it's kind of tough to get there. But one advantage that the skin has is we can get chemicals to it topically if we can fool the epidermal barrier. And there are topical forms of green tea that will give you a sufficient supplemental dose of antioxidants absorbed through the skin if you're using products with green tea. So I'm a big fan of green tea and the polyphenols that it contains. Witch hazel, I am not aware of as being an antioxidant. I'm not aware that it has any power to be able to fight free radicals. So I don't think the witch hazel is going to help as much as an antioxidant as it will just in helping acne breakouts and to dry up acne breakouts. So that's where we come out there, Josh. And by all means, however you can do it, please do use a topical antioxidant every day, in addition to a topical exfoliant, particularly a glycolic-based exfoliant, and a sunscreen. Those are the three essential skincare products that you need to use every day for healthier, younger, and more beautiful-looking skin. Sunscreen, exfoliants, and antioxidants. I have a comment from Paula, and Paula tells me that her vitamin C serum is 20%, but a combination of ascorbic acid, sodium phosphate, ascorbyl palmitate. Is that a good vitamin C? Well, the ascorbic acid is not very stable. That's the plain vitamin C. The sodium phosphate and ascorbyl palmitate, the ascorbyl palmitate has a better chance of being absorbed. So again, without knowing all the other chemicals in your product, I will tell you that the sodium phosphate and the ascorbyl palmitate are reasonable ways of trying to get your vitamin C. I prefer tetrahexadecyl ascorbate or ascorbyl ascorbate. So if you do have the ability or you have the opportunity to get either of those, that's what I would recommend, and especially the tetrahexadecyl ascorbate. From Sophie, she says, thanks again. Hope we can get to see Cooper sometime soon. Thanks, Sophie. And we have a question from Mike. Why doesn't BHA matter when it comes to the free acid? So if it's a 2% BHA product, do you get the full BHA? And if not, how much do you get? Well, BHAs are different from AHAs. And the BHAs are lipid soluble. So it's not the same interaction in terms of it being protein bound the way the water soluble HAs are are protein bound. And it's just not the same chemical reaction, Mike. So with BHAs, the 2% is what you're going to get. It's going to be the 2%. It's not the same equilibrium system between free product and protein-bound product. Helen asks me, how do you prevent moles? Are they genetic? Helen, they are genetic. Most of them are. Most of the moles that you're born with were determined at the time of conception by the genetic contribution from your mother and your father. But only about 10% of our moles are we born with. About 90% develop during life. And the 90% that develop during life, most of the raised ones are, again, genetically determined. You have no control over what's going on there. But a lot of the flat ones that we get, particularly the abnormal ones, these are the dysplastic nevi. A lot of the abnormal ones are caused by an overdose of sun. And that overdose is not a chronic accumulated overdose, but rather it's a short intensity, high impact burst of ultraviolet damage from the sun, such as the kind you get with a blistering sunburn or where you really get a lobster red sunburn. So your control over those moles not coming out is by using adequate sunscreen. I don't tell anybody not to go in the sun. I tell people how to protect themselves in the sun, which is by using an effective sunscreen and using it properly. That means a sunscreen with an SPF of between 15 and 30, with either UVA protection or broad spectrum protection. But the real key here is not just using the sunscreen in the morning, but you've got control you have over the development of your moles is preventing the sun-induced moles, which is by using effective sunscreen. Effectively now is going to prevent the moles from coming out in 10, 15, and 20 years. Again, this is BeautyRx Live. I'm Dr. Neil Schultz. If you have a question, please go to BeautyRxLive.com, use the chat box, ask me your question, and I'll get to as many of them today as I can. Jim asks, I'm trying to get rid of my blackheads and whiteheads, and I use 15% glycolic acid every other day, and it doesn't help. Either an 8% or a 10% product. And you can use that on the days you're not using the 15%. And as a result of using that, if that hasn't helped stop the blackheads and whiteheads, then why don't you try using the 15% on a daily basis? In addition to using a chemical exfoliant, this is a case where a physical exfoliant may actually be helpful. So using a granular cleanser, such as the BeautyRx Pore Minimizing Cleanser. These are granules that help to actually remove the clogs and the whiteheads and blackheads, and it's used just at the end of the shower. So at the beginning of the shower, you use your regular acne cleanser, which will take the oil off the surface. And at the end of the shower, when your pores have been steamed open by the warm water, that's when you use your granular cleanser. And the best way to do that is by very gently massaging it into the whitehead and blackhead prone area for about 10 or 15 seconds, then rinsing it off with warm water before you get out of the shower. And lastly, don't forget that using a gentle chemical exfoliant like the 15% glycolic you're using really is the best other thing that you can do. I would recommend using a toner that has a small amount of alcohol, maybe 5 or 10% alcohol, regularly after your cleanser, again helping just to remove more debris and helping to unload more of those dead clogging cells. Alana asks, what are the benefits of tea tree oil? Is it safe to use on the skin? Alana, I love essential oils, and tea tree oil is an essential oil. And of all the essential oils products, and the reason that I do is because tea tree oil kills germs. It's antimicrobial. It kills bacteria. It kills fungi. It kills yeast. And in addition, it also helps to reduce inflammation. So I'm a big fan of tea tree oil, from anywhere from 0.1% to 1% concentration. If you put in more than 1%, it may actually have somewhat of an off odor, so you may not want to go there. Okay, one of our producers mentions that on his audio feed, what I'm saying is breaking up. So please let us know, listeners and viewers, whether or not I'm coming through clearly, whether the video is breaking up, whether the audio is breaking up. We want to make sure we're not having a technical problem. We'd appreciate hearing from as many of you as we can. Let us know if we're coming over loud and clear, audio and visual. Thank you. Let me get back to our questions. Okay. Cindy asks me if a product with 10% azelaic acid can work on acne. She's tried products and they're too strong for her skin. By too strong, I'm going to assume that means that it's irritating or causing redness. Azelaic acid is really useful for two things. It's useful for acne, and it's also useful for decreasing melanin pigmentation, excess melanin pigmentation. But in terms of acne, if 10% is too strong for your skin, then why don't you take your moisturizer, and I assume that if you have acne, that you're using a water-based or an oil-free moisturizer, and why don't you mix your 10% azelaic acid half and half your moisturizer, equal parts, mix it up, and try that on alternate nights, and see if by cutting the strength by a half, and using it on alternate nights, whether that, if it is okay, after a week, then go to using it every night. And you know, something interesting may happen. If you can build up gradually like that, you may then, at a certain point, be able to start reintroducing the original 10% product on alternate nights. And again, as long as you're tolerating it for a week or 10 days, then you may even go to the 10% every night. But try diluting it and then building up gradually. Again, welcome to August's version of BeautyRx Live. We're streaming over live streaming video, and if you have any questions, please go to BeautyRxLive.com and enter your questions in the chat box. I don't know if we've gotten any responses about our audio, and we think that we may be having a problem, so if we are, please let us know. Let me know if I've just been speaking to myself for the last 20 minutes. I have a question from Melanie, and Melanie says she wants to start exfoliating. What do you recommend? Melanie, the best way to start this is with a low-strength chemical exfoliant. Obviously, I love glycolic. I would start with probably an 8% product, unless you have unusually sensitive skin. And using an 8% product, make sure it's vehicle appropriate for your oil and water skin type, meaning if you have oily, acne prone, or combination skin, then you want to get it in a light serum or a light solution. If you have normal or dry skin, you may want to get it in a cream, and you start using that every night. If it's a cream, use a pea-sized amount in your palm, and from that pea, go dab, 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 all around your skin. It should spread, disappear, and set in a minute. If it does, then you're not using too much. If it doesn't set in a minute or two, take a tissue off the rest and use less the next night. You start by using that every night, and if after 2 weeks you're tolerating that and you're not having any irritation, and you could have some tingling for 10 seconds or 15 seconds, but it shouldn't be burning for a half a minute or a minute, and you then gradually work your way up to 10% and then perhaps a 15% product. As many of you know, I prefer chemical exfoliants to physical exfoliants. I think they work better. I think they have more predictable results, and I think you can be much more accurate and precise with chemical exfoliants, since you get the exact percentage of whatever is in that exfoliant, as opposed to physical exfoliants or mechanical exfoliants like buff puffs or loofahs or granular cleansers or microdermabrasion. If that's your only form of exfoliation as a physical exfoliation, the results are going to depend on how hard you press, how long you do it, the size of the particles, and things like that. So chemical exfoliants really are the way to go, especially if you're just getting started. Okay. Question from Mike. My AHA gel 10% acid has a pH of 3.6. How much free acid is in it? So, Mike, I can't tell you the exact amount, but I can tell you that the pKa of glycolic acid is 3.825%. It's not going to be more than 6. It's going to be between 5 and 6% free acid. I say to use it at bedtime for a month. Is it okay to use it twice daily? Sure. If after using it for a month you're not having any ill effects, by all means you can go ahead and use it twice a day. As a matter of fact, there's a BeautyRx product called Exfoliating Green Tea Complex SPF 20. And the Exfoliating Green Tea Complex is a morning product. It has an SPF of 20, it has green tea in it, which we had a question about before, but it has 10% glycolic. And I recommend this as a combination exfoliant, sunscreen, antioxidant to use in the morning, an antioxidant because of its anti-inflammatory powers. But here's a way of getting 10% glycolic in the morning, in addition to using your straight glycolic AHA at bedtime. So yes, there's absolutely nothing wrong, and I encourage you to use it twice a day, as long as we're not letting it interfere with sunscreen. I'm just looking at a comment from the producer. What I'm told is that we're having a problem with the audio feed, and we're not sure why, although Are we getting comments from viewers that they can't hear us?
No.
No, okay. Well, if we're not getting comments from the viewers that they can't hear us, okay, so there is a comment here that he's breaking up, and I have on my screen that there's breaking up 100%. That's what the question,
It's not a question.
that's what the poll is saying. Okay, so I think that as a result of the technical problems we're having, we're probably going to wrap up a little early. So let me take two more questions, and then we're going to call it a day because I don't want this to be a frustrating experience for everybody. I have a question from Lily. She has rosacea. Can she still use an exfoliant? Sure you can, Lily, even with rosacea. But again, this is a matter of balance and common sense. So maybe you want to start with a 5% product, start it once a week, then go to twice a week as long as you're tolerating it. Almost any kind of skin can use a gentle chemical exfoliant as long as it's pH adjusted and buffered. You just want to make sure you start it very gradually. If you have some tingling for 10 seconds, 15 seconds, that's okay. If it's burning and stinging for a half minute, of course that's not okay. And then you're going to rinse it off, and you're just going to build up gradually. And as a last question for today, I'm going to answer a question from Teresa, and she asks, "Are 30% BHA peels effective?" And Teresa, the answer is that a 30% BHA peel, which is a 30% salicylic acid peel, certainly should be effective. It should make a big difference. But 30% salicylic acid is strong enough to maybe cause some peeling and some redness. So before you have one of those peels, I think that you should know that you may get a little downtime from it, so you may want to be careful and make sure either you test it in an area or do it at a time when a little redness or peeling for a couple of days afterwards isn't going to cause a problem. And of course, I would recommend having it done professionally rather than doing it at home, so it's done by somebody who's used to using a 30% peel and who can help to make sure that you won't have a problem. So because we believe we're having some problems on the audio feed, we're going to wrap it up here for today for August's version of BeautyRx Live. Thanks for sending in your questions. Your questions are great, both here at BeautyRx Live as well as at Derm TV. So many of your questions become the subjects of my Derm TV episodes. Please sending them in. Keep sending them in. Stay tuned. We'll talk to you next month. And thank you very much. So from BeautyRx Live, this is Dr. Neil Schultz, and have a very happy, healthy, and safe Labor Day weekend with lots of sunscreen.